So Palmetto is a plant. It is one of the most popular dietary supplements used for prostate health and hair loss. After age 15, around half of men develop prostate problems. Most commonly, prostate enlargement, which is medically called benign prostate hyperplasia. At the same time, around half of men experience hair loss, which is called androgenetic alopecia. So Palmetto is used for both conditions because it targets both prostate and hair loss. So Palmetto historically was used in American population, especially for people with difficulty urinating and for male vitality. So Palmetto later entered in Western medical literature as a remedy for urinary problems and prostate-related symptoms. Men who consistently take So Palmetto often report improved urinary flow and reduced pelvic discomfort. Men who have prostate enlargement have symptoms like weak urine stream, delayed initiation of urination, incomplete bladder emptying, and nighttime urination. When the prostate gland enlarges, it surrounds and compresses the urethra, and this causes urine flow obstruction and related urinary symptoms. The problem is that we have testosterone, which is a male sex hormone, and it is converted into another form of testosterone, which is called dihydrotestosterone. And this dihydrotestosterone is about 5 times more potent than testosterone. It stimulates prostate cell growth and causes hair follicle miniaturization. This is why prostate enlargement and hair loss occurs. So Palmetto works by blocking the enzyme that converts testosterone into dihydrotestosterone. This enzyme is called 5-alpha reductase. The action of So Palmetto is not strong. It reduces dihydrotestosterone, typically targets tissues about 20%, while testosterone levels in the blood remains unchanged. So the effect is not systemic testosterone suppression. So Palmetto usually don't affect brain androgen receptors or muscle mass regulation or bone metabolism. That's why it don't cause sexual side effects, unlike similar medications such as finasteride, which has a much more potent. So Palmetto also has anti-inflammatory action. It reduces prostaglandins and leukotrienes, which contributes to prostate swelling, pelvic discomfort, and bladder irritation. So Palmetto is most effective in people with mild benign prostatic hyperplasia, in men who avoid sexual side effects from other medications, and in men with mild hair loss. So Palmetto is not effective and not appropriate for people with severe urinary obstruction or acute urinary retention or advanced prostate enlargement that requires surgical treatment. Accordingly, So Palmetto does not work quickly. For initial improvement, it typically requires around 6 weeks. Maximum benefits is usually reached by 12 weeks, and continued use is important to maintain the effect. If So Palmetto is discontinued, this often leads to gradual symptoms return within about 8 weeks. It can still be clinically relevant. For hair loss, So Palmetto can slow hair shedding and stabilize thinning, but it does not cause regrow. So it's not considered very effective, but still important. Most people worry about sexual problems with So Palmetto intake, but this is not true, because sexual side effects with So Palmetto are reported around 1%, which is similar to placebo, in contrast with finasteride, which may seem similar to So Palmetto, but it's a medication and it's much more potent and causes side effects around in 10% of men who take it. So Palmetto does not affect brain androgen receptors or dopamine pathways on which libido depends. It also not interfere with nitric oxide pathways or vascular tone in penis, so erection remains stable in vast majority of cases. And now let's talk about Palmetto's hair loss effect. Hair loss is complex, but it's highly dependent on dihydrotestosterone, which shrinks hair follicles and shortens the hair growth pace. The effect of Palmetto is modest. It reduces dihydrotestosterone by around 20%, while closest pharmaceutical medication reduces dihydrotestosterone around 70%. Because of this, its effect is weak, but it still slows the progression of hair loss, stabilizes shading, and preserves existing hair follicles. It does not regrow bald areas and does not reverse long-standing miniaturization of hair follicles. For this reason, when hair loss treatment is used, Palmetto works better in combination with minoxidil. Minoxidil improves blood flow to hair follicles, prolongs the hair growth pace, and reactivates miniaturized but still viable follicles. When combined with minoxidil, the effectiveness of the treatment increases around 65%, while Palmetto alone is around 30%. Most common regimen is Palmetto 320 milligrams per day with food, and minoxidil 5% topical solution or foam applied twice daily. Sometimes Palmetto is also combined with pumpkin seed oil. Pumpkin seed oil contains phytosterols. It has a mild 5-alpha reductase inhibition effect, but also reduces scalp inflammation. It improves microcirculation and protects cells from oxidative stress. Because of this combination works better, pumpkin seed oil aids around 15% of effectiveness, especially in cases where diffuse thinning and stress-related shedding is represented. A typical regimen is pumpkin seed oil 400 milligrams once daily with food. It can be taken together with Palmetto. When Palmetto pumpkin seed oil and minoxidil are used together, there's around 70% stabilization and improvement of hair loss in early androgenetic alopecia with 6 to 9 months, with continued improvement up to 12 months. Palmetto, pumpkin seed oil, and minoxidil are generally safe for long-term use, but if they are stopped, the benefits gradually reverse within several weeks.